Today I'm going to show you a form of soft tissue treatment called pin and stretch or tack and stretch. A tack and stretch technique is something you can perform on yourself to work different areas of muscle and soft tissue. The overall principle is that we're holding one area of muscle stable and then we're contracting the muscle on the other side of that joint. So for instance, if we're wanting to work this area of the forearm, this is the wrist extensor. So to make that muscle tighten, what we do is bend our wrist up. The muscle on the other side of the joint is the wrist flexor. Find that tender area, and then we're going to flex the wrist and holding that part of the muscle down as we go through a full range of motion. And then you can just work your way up and down that muscle. You can do this for most areas of the body and use that same concept, holding the tissue still and then contracting the muscle on the other side of the joint. Let's say we want to work the tibialis anterior, so the front of the shin. That's a common area of tightness for many people. So what we can do is just palpate, find an area that's tender or a little sensitive. We're going to hold that and then we're going to contract the calf. So we're going to be pointing the toe down as we go through that full range of motion. We can do the same thing with the calf, finding a nice tender area, and then we can hold that still. You can vary the amount of pressure, holding that down and then bringing the toe up and dorsiflexing the ankle. And you can work all the way up and down that calf muscle. You can use this in the neck, so say in the upper trapezius, we're going to tack that down with our hand, and then we're going to side bend away. So using the muscles on the other side of the joint and taking your neck through its full side bending range of motion. And you can work all the way up and down the neck and upper trapezius. Same thing with neck flexion. So let's say you have tenderness in the back of the neck. Just going to tack one area down and then flex the neck. So bringing the chin towards the chest. If you have a TheraCane, that can also be a really useful tool in this situation to be able to get areas that are a little bit harder to reach. So say if you had tightness in the back of the shoulder that you were wanting to address, you could use a TheraCane to hold that sensitive area down, and then we're wanting to contract the muscles on the other side of the joint, so the pecs, and we're going through that full range of motion. You can see it's a little bit difficult to be able to reach yourself, so using something like a TheraCane is often pretty effective. So again, tack and stretch, it can be a very useful technique. Using it for temporary improvement, we always want to follow it up with more of a dynamic stretch and then loading or strengthening that muscle in that new range of motion. I hope this helps. If you have any questions, please leave them in the comments below, and we'll see you next time.